This segment is sponsored by Holy Cross Health. As flu season approaches, experts recommend getting the flu vaccine, wearing masks in crowded areas, and practicing good hand hygiene to stop the spread.
It's also important to know when to seek care at your local emergency department. So joining us today to tell us about the importance of taking these precautions is local physician and emergency department leader, Dr. Holly Mears. Welcome to Great Day, Washington.
Thanks for having me.
Everyone's gearing up. Flu and cold season is upon us.
Yes, you're absolutely right. And it's so important that we're all ready because, you know, this is something that people need to take care of themselves, but it's also taking care of yourself, your family, and your whole community. So this really impacts everyone. So it's important, if not just for yourself, but for everyone else you love and care about too.
Let's start with the flu. No one wishes that on anybody.
No.
What do you think about the flu vaccination and the importance of it?
You know what? That's the best thing. That's the most important thing you can do to prevent flu. It's people talk about, oh, am I going to get the flu from the vaccine? And that's not the case at all. I think sometimes you can feel a little sore, your arm is sore, maybe have a little bit of a fever at times, but it really is worth it because it can prevent the flu. If you do get the flu, it can be to a lesser degree, and certainly try to minimize any sort of hospitalization, which is really important.
What is your thoughts on the role of masks when it comes to flu season? Should we be wearing them? How does it work?
Well, and if you're sick and have a fever, you should stay at home is really the best thing to do. But if once you don't have a fever for 24 hours without taking medicines and are feeling better, you can go out and about. But it is really helpful for you. I know we've probably all had a little bit of mask fatigue at some point, but it's important. And again, this is one of those things that's going to keep you safe and keep your family safe and your community safe. So if you're not feeling well, err on the side of wearing a mask. And you know, in addition to the mask, the other things you want to keep up with is good hand hygiene.
Yeah. What do you recommend there? I used a lot of hand antibacterial, but I feel like hand washing is better. Well, what do you think?
Washing with soap and water, that's perfect. But you need to wash for like at least 20 seconds whenever you're doing that to make it effective. If that's not available, the hand sanitizer is really convenient, as we have all learned to have around. And so that is effective, but an alcohol-based hand sanitizer is another alternative.
Can you overuse it and then it becomes not effective? That's what I keep hearing, and I get nervous now. I'm overusing
We've gone
the
through
hand
a lot
sanitizer.
of bottles of hand sanitizer in our office.
Yeah. Well, it can dry your hands certainly, but you know, want to keep your hands moisturized because you don't want to have cracks in your hand and sort of have
hurting.
So it's do the right thing, keep yourself clean, but you don't have to become obsessive.
Okay.
We know the flu. We know the flu can be at different levels for folks, right? Of how they get it. What should we know about when it's time to seek medical attention?
Well, I think, first of all, if you're someone who is vulnerable, if you're over 65, if you have some sort of immunocompromise, pregnant, or a young child, I mean, those, or have some other pre-existing condition like asthma, diabetes, heart disease, those are the people who really can be the most vulnerable. Any of us can be vulnerable, but that, group of people are most vulnerable. So you need to sort of be aware. We all need to watch ourselves if you're getting sick. If you are, a young child who has a fever, probably needs to seek, less than 12 weeks needs to seek medical care for sure. If you are having really trouble breathing, a lot of muscle aches where you can't even move, chest pain, turning blue in the face, things like that that are really significant. Most of the time flu doesn't really include nausea and vomiting, but you're having some intractable, nausea and vomiting that won't stop. Those are the times you need to come to the hospital.
I know that there are a lot of resources out there for people. Do you recommend anywhere should we be going as we're going through this season?
Well, certainly, keeping up with your primary care doctor. Again, the prevention is huge. One, just for general medical care, but also with the flu is just get that vaccine. Be in touch with your doctor. Sometimes people you can get it through minute clinics or any sort of like small things like that. That's another a way to reach out. But you can talk to your doctor. A lot of times you can do a virtual visit, check in, and if you need to have some medications, again, that vulnerable population, there's some antivirals if you do have the flu. That group would probably benefit most from having those sort of medicines.
Staying informed and staying in touch, really.
Absolutely.
Dr. Mears, thank you very much. We appreciate it. And for more information, you can visit holycrosshealth.org.